Jennifer, thank you for bringing this story to us. I'll go ahead and let you take it from here.
We did an interview on Friday with somebody who works in, her name is Elise Barrett. She works in the medical field and has tons of wonderful information about COVID that she was kind enough to share with us. And so she's going to talk a little bit about the vaccine, how the ways in which we're kind of like not seeing the flu, but the significance of that as well in the context of COVID. And she just gives us tons of really great information that I think will help answer some of these big lingering questions that a lot of us have about COVID.
Yeah, I can make it happen.
Hey, Malcontents, this is Jennifer, and I'm here today with Elise Barrett, who's going to share some of her knowledge about what's going on with COVID. Hey, Elise, how are you doing today?
I'm doing really good. I've had a lovely day, and it's Friday, so I get to go home after this.
That's fantastic. Well, thank you for being with us today. What are some of the things that you're kind of witnessing during this epidemic that people should be kind of aware of what's going on?
It's definitely not a hoax. I have many family members who live in areas where it is sort of considered a political opinion whether this exists or not. And unfortunately, this weekend I discovered that my mother and her husband have COVID and are looking at potentially a pretty rocky course in the disease. So it's been a difficult thing for this last year, seeing my patients be affected by it, seeing my staff dodge it through, we have not had one infection on my unit, but we've had incredibly tight lockdowns and been very diligent in keeping ourselves protected and seeing the difference that following the science and listening to what's being told makes and not getting it.
What are some of the most frustrating, myths that you deal with surrounding COVID?
First myth is that you have to lock yourself in your house and never go outside and never interact with another human and be living in fear. That sort of creates a degree of tension and dread and almost fatalism that's impossible to sustain. You can't live like that in your house alone without suffering great harm to your mental health. And fortunately, we've had a lot of work done by experts in the field to tell us how we can interact with each other safely and how we can be out of our houses and how to avoid catching the disease while we're just trying to spend some time with friends. Unfortunately, that does involve distance. It involves wearing what we call personal protective equipment, PPE, or masks, which, of course, in the nursing field and medicine, that's old news. We've been doing that forever. We know how effective it is. But that's still a new concept for a lot of people, and there's a lot of fear around it for a lot of people because it is tied to this concept of being medical, being rigid, maybe being under a doctor's care, having to follow orders.
Can you tell us a little bit more about where the flu is in all of this? We hear so much about COVID, but we don't have an understanding of what's going on with the flu right now.
Well, the flu is less contagious than COVID. So anything that stops the spread of COVID even a little is going to impact the spread of flu much more. We've actually seen a significant amount of flu in the community, mostly among people who are still getting out and around and moving in the community. We've actually seen a much lower prevalence in the older community and the populations that typically make up most of the casualties of flu season, simply because those people are scared to death of COVID and being smart and staying in their houses. So if you're wearing a mask during flu season, you're actually pretty well protected against flu. It's not as easy to catch it as it is to catch COVID. It requires a much higher viral load, and those little viruses are much bigger. If you're wearing a mask and somebody breathes COVID on you, you could still catch it. They're very small viruses, and it doesn't take much getting through to make you sick. So if you're protecting yourself against COVID, you're protecting yourself against the flu.
And getting a flu vaccine, of course, is also kind of helpful should you get COVID, because is that something?
Yes.
Okay.
Unfortunately, what we're seeing is that quite a few people who get COVID also have the flu. And probably got it around the same place. And those two diseases don't go well together. You can get much, much sicker with the two together. In general, the flu shot is one of those great examples of how a vaccine can, even if it doesn't prevent you from getting the disease, it can make the disease much less intense when it happens. So the less time you spend debilitated and laying in bed with the flu and going, oh, I can't move, I feel awful, that's more time that you might not also get COVID at the same time. It's more health that your body has in reserve to fight off COVID if you get it. And it's less time that you just spend miserable. Who wants the flu?
Great interview, Jennifer. Thank you so much.
Yeah, she was wonderful, just like a total wealth of knowledge. And I learned a lot through that. So,
Yeah, and we got the answer to one of the biggest questions that a fair number of people are asking: where's the flu?
mhm. Yeah, yeah. And I think she really did a good job of stressing the significance of still getting that flu vaccine, even though, you're not going out as much and people are thinking that the flu isn't really as active as it's been because people aren't really going around people as much as they normally would be. But she's also like, right, who wants to be sick and with the flu and have COVID on top of that? So it's better off to, protect yourself.
Yeah, another topic on COVID, which is not good news. The UK variant, this very highly contagious UK variant, has reared its head in both Snohomish and Pierce County. And of what we know in testing patterns, if they're starting to see it in testing, it's not just these isolated cases. They're in community spread, especially because I believe the person from Pierce County has never gone and traveled, but did go to an event where they shouldn't have maybe done that.
Yeah, and that's the thing. I think people are maybe starting to think that they can just kind of live with COVID. And, Elise talked about it. We talked about it in the interview a little bit. You don't have to, completely shelter yourself in place, but you do need to be careful about who you're coming into contact with. And I think people have been enduring this pandemic for so long, they're getting more comfortable with potentially going and seeing people or just not making smart choices. And that's what's going to continue to keep us in this current state we're in longer.
Yeah, I was double masked last night and going up some of those hills in Tacoma. Certainly not any of this, I'm gonna have an asthma attack, but I could definitely feel in doing cardio with all of that equipment and safety gear, I could feel the resistance of wearing two masks.
Yeah, absolutely. So again, people need to be smart, maintain social distancing, get your flu vaccine, wear a mask, wash your hands, all of that good stuff. Because the rest of us would like to go places with other people other than the grocery store sometime.
Jennifer, thank you so much for that. We're going to do another little pause for the cause, and we're going to go to the next story.
Initially kind of came in and, said, hey, we're going to have to start moving people. And then a couple other people came in and were like,
police to be held accountable for their actions. We're not going without no justice, no peace. No justice, no peace. No justice, no peace.
Can You Hear Us is our documentary about the events that happened in Seattle from June 1st to July 4th. And the documentary is out, but it's not out for everyone. Hey, patrons, if you haven't gone to Patreon and checked your inbox, you need to check your inbox because the link to Can You Hear Us is there, as promised on January 25th. If you would like to get a sneak peek of Can You Hear Us, you can become a patron at any level, and you will have immediate access to it. We will be doing general access. It's free. We are sending this out because we want to get the word out, but we will be doing general access to everybody at the end of February. And with that, we're going to go ahead, Jennifer. We'll go ahead and jump into our next story.